Hello, everyone. I just thought that I will try to explain what is the difference in homeopathy between acute prescribing and chronic prescribing, and why we often suggest that you work with a homeopath if you have a long-term health issue. So let's talk about three different scenarios. So first aid situations are situations that include accidents and emergency events that require prompt medical intervention. You can still use your remedies while you're waiting for the ambulance or while are you on the way to the hospital. Prescribing in this situation will be more similar to your classical allopathic or mainstream healthcare. That means X situation happens, we give Z type of a remedy, right? So everybody with the same type of accident, let's say, will get the same remedy. Anyone can administer the remedy. The dose will depend on intensity. The more intense, the more frequently you would dose. The remedy can be repeated very frequently, even every 5 minutes or so. And if the right remedy is given, you will rarely require more than 4 doses and you will feel better. Acute illnesses are generally self-limiting. So there's a slight difference between first aid situation and acute illness. First aid really requires you to find a healthcare professional and medical attention. Acute illnesses are often self-limiting, typically resolve on their own with time. For example, cold, flu, cough, stomach bug, or something like that, or sprains of ankles, minor bumps when your child is running around outside and they fall and hit their knee or something like that. Prescribing in these situations requires basic understanding of homeopathic concepts, such as the law of similars, which I might explain in another video. Remedies are more individualized using the CLEMS analysis of presenting conditions. And I will link for you my other video on the CLEMS acronym. And we often need to differentiate several remedies based on the actual symptoms, what is actually happening. For example, cough remedies. There are hundreds of remedies for cough. It just depends on what the cough looks like for you specifically or for that particular person specifically. The remedy can be also repeated in intervals quite frequently depending on the severity of symptoms. And if there is an improvement, you stop taking the remedy and you wait and see. If no improvement is reached within 4 doses or so, you need to reassess your symptoms and possibly try a different remedy or speak to a homeopath. And there are various services that you can use, like Homeopathy 24/7 or Swift Homeopathy Clinic, where you can speak to a homeopath 24/7 and they can help you differentiate the remedies or prescribe a remedy that might be best fitting your actual situation. Now, chronic conditions or chronic prescribing applies to long-term health issues and conditions with specific diagnoses. So that means things like asthma, eczema, autism, arthritis, thyroid issues, things like that. This requires a much deeper understanding of homeopathic concepts, health and pathology, methodologies, and remedy relationships. Full case history must be taken and reviewed, including unique and peculiar symptoms, mental and emotional characteristics, overall and inherited tendencies, as well as modalities and sensations. and also broader family history, etc. When I work with patients, I ask about everything from their mother's pregnancy with them, their own birth, their childhood, regardless of how young or old they are. All this is really important for their health now, right? Even if you are, I don't know, however long, whatever has happened during pregnancy, while your mother was pregnant with you, or your birth, that could have affected your health in the way that you are now in the situation where you are. I'm not saying it's always the case, but sometimes it is. So in homeopathy, we have to ask about all these things, include all these things in our analysis of your situation to understand where is the issue, where is the deficiency in your body, and then help your body process it and overcome it, hopefully. So that's why self-treatment in these situations is not recommended, as it can create further confusion in the disease picture. And I've seen many people with really complex chronic long-term conditions who are trying to cure themselves, which is fine. We all want to kind of take charge of our health and cure ourselves. However, if you're doing it by yourself, it can take a long time to kind of research all the information out there. It might mean that you will do mistakes along the way because you might be trying things that are actually not appropriate for you. So it might also lead to kind of waste of time, waste of money on supplements or whatnot you're trying. Plus, if you are doing a lot of things, and that applies also to parents who are trying to cure their child, especially if the child has a complex condition. And I get it, I'm a parent as well. And obviously, if our child is ill, we want to help them and we want to try to throw everything at it. But a lot of the times, we just overdo it. We just throw too many things in the game, and that just confuses the body even further and makes it just more blurred and complicated. So in chronic conditions, it's best if the treatment is overseen by a professional homeopath who can have that helicopter view, review all aspects, research relevant remedies. There is around 10,000 remedies in homeopathy these days. So, I mean, you can be Googling remedies for your condition and you will probably be able to Google something, but those will be maybe just the most well-known remedies, which might help to an extent, but they might not. You might need completely different remedy. So it's kind of important to find someone who you trust and who can support you on that journey. One more thing with that is also AI. These days, you can use AI like ChatGPT to ask what remedy can I use for my condition, whatever. And it will probably give you some information, but because it doesn't know your whole history, your whole situation, it might not give you the right advice. And again, it might just make things worse, or it might not work. And then you kind of lose the trust in the therapy unnecessarily. And that does not apply just to homeopathy, that applies to herbalism, to all sorts of other complementary therapies, right? Or supplements. If it's not the right thing for you, it's not gonna work. But that doesn't mean that the whole thing doesn't work, right? So by no means it's fine to Google remedies for your acute illnesses, for the flus and fevers and teething and whatnot. But if you have long-term chronic condition or your child has, please work with a trained practitioner who can guide you and make it easier, safer, and faster to achieve results. I hope it helps a little bit to give you an idea what's the difference between acute and chronic prescribing. If you have any questions, don't be shy to get in touch, and I'll be happy to answer them for you. Bye.